Good morning, good afternoon, and good evening, everyone. Respected Chief Executive of AHIN and distinguished guests from our AHIN community, my dear students, welcome to this webinar, which is about Masters in Health Informatics course under School of Engineering, Kathmandu University. We have started Masters in Health Informatics course in 2022, and we have already admitted 3 batches, and the total capacity of the students is 20. So in latest batches, there are 20 students. So between October and November, we will have another announcement for the new batches. So we have in this health informatics course, we have a health financing courses. Under that health financing courses, we have incorporate openIMIS for a practical session. So health informatics, health financing course is of 3 credit. 3 credit, 1 credit is equivalent to 15 hours, and so 3 credits means 45 hours. And our this practical session of health informatics is of 15 hours. So today, me and my team member, Mr. Rasis, who is also a lecturer in the Masters in Health Informatics course, in particularly for this openIMIS technical aspect. He is looking after and teaching students at Kathmandu University. Will give brief information to all of our this prestigious AHIN community, and I would like to thank AHIN community because of your support, your encouragement, and the big portion of this team member encourages us, and finally we could establish this Masters in Health Informatics courses. In fact, so most of the thing I have already mentioned, and after establishment of Masters in Health Informatics course, our university decided to make new departments so that we can teach bachelor level, master's level, and PhD levels health informatics courses. So finally, last year, our university School of Engineering Department of Health Informatics, and our master's program is inside Department of Health Informatics. The major research focuses in this master's course and PhD courses are digital health system, especially open source system like openIMIS, DHIS2, openIMIS, Bamini, and other system we teach our students. And health financing and economics, as I mentioned, this is the focus of this presentation of this webinar also. And our aim is to make our to understand our students about how data from different tools, different health IT tools like DHIS to openIMIS to openIMIS, how we can exchange data, keeping the standard format, exchanging the data between among multiple platforms. That is the main motto of our Masters in Health Informatics program. That is why we established Health Informatics Lab under this program. And we also focus on health IT policies and system implementation. We have another courses for this one, ethics and other health policies courses. So this is the thing. And here, why we integrate openIMIS is most of us within this community know that in Nepal, about 8 million people are enrolled in openIMIS insurance system. So that is why this could be very good real life experiences for our student, and once they will be graduated, they can contribute to our health insurance board and our social security fund, who are insuring Nepalese citizen under government health insurance policies. So this is the very crucial part for us to go with openIMIS. Here, after yes, okay. So I have this is the course code 525 HMS health financing, and mostly to credit will teach about health financing system of Nepal and abroad, and then we'll give the hands-on trainings about openIMIS different activities. Next. So key learning components through openIMIS here are health financing workflow. Most of us know about this enrollment process, claim process, and reimbursement mechanism, and technical infrastructure, server deployment. Previously, when we were working on around 2022, at that time we used to work on Windows base also, but this time when modular openIMIS has been developed, we also focus on Linux, SQL Server, and Nginx and Docker are the main technical infrastructure for this tool. Interoperability standard, obviously implementation of HL7 standards for data exchanges, alignment with policy, curriculum design to reflect national health insurance framework and global health financing standards. So course agenda in health financing and openIMIS, here we briefly talk about the course overview, and then practical components, simulation, installation, and interoperability that are the thing mostly Ashish will describe about that. Evaluation and outcomes assessment of framework and competencies, because this is academic course for master's student. And we have already shared most of the, all of the documents that are needed for this 1 credit openIMIS based practical lab session for health financing courses. So I would like to request our organizer, Ehin, please comment on that, and we'll incorporate them if needed. So learning objectives, knowledge and skill in health financing, there are 5 aspects. First is health, compare Nepal social health insurance with global financing models and analyze key challenges and policies implication. As we know, normally the health system is also influenced by the prosperity of the country. So it is quite challenging. Many of us knows about this challenging part of our side. openIMIS gains hands-on experience with enrollment, policy creation, and claims management while building role-based competencies. And the platform Linux installation, configuration, optimization, openIMIS on Linux using Docker, MS SQL, Nginx for scalable secure deployments. Fire, as we know, it is for interoperability. We'll use for exchanging data there. And some issues, evaluate equity, sustainability, and donor dependency in health financing, and reflect on global policies implications. As you know, most of health-related or most of the global initiatives are dependent on donors. Donors. So until and unless they are supporting the project or the things moves on, and due to the lack of resources, to make sustainable of any good things in the health IT domain. It is hard for the government to carry on. This is the part we are facing in different projects. Now, I would like to ask Ashish, please, this is the floor is yours, and continue the presentation. Thank you, everyone.
Yes, thank you, sir. Hello, everyone, and a very warm namaste. I'm Ashish Koirala, and I've been a part of HIMS 525 health financing as a practical session lecturer for about a couple of years now. So during our first initial days, what we thought was interactive as well as effective was distributing a certain whole semester's course into 3 parts. So we use a certain incremental approach where the first part will be of data entry, where the students will act as an administrator. They will work as a enrollment officer. They will use a certain simulation to work as a claim administrator and claim reviewer, so that they will get an experience of a certain claim administrator, review, and enrollment officer as a whole. Collectively, they will be working as an employee of openIMIS who does their work for health financing. So talking about these roles, the enrollment officer manages beneficiary registration. Here we are talking about creating families, creating members, such that they are willing to do financing for their own health here. In the sense that in Nepal, in the country like Nepal, when we do certain health insurance, we need to provide our details. We need to provide our profiles to the enrollment officer. They take our profiles and then they create a certain data, and then they create the profile, and then claim administrator submit the health service that the patients have taken. Then the reviewer verifies and approves the claim. Then the payer, and the payer here is the HIB, Health Insurance Board of Nepal, who pays, who contributes for the health insurance part in Nepal. So this way, they will be able to, the students will be able to get a simulation for the openIMIS, different activities we do in openIMIS. So for this, we provide students with the local server, the server that is being managed inside Kathmandu University's lab. And another choice is demo server. Sometimes if the local server is not responding quite well, we also use demo server. The demo server is on demo.openimis.org. We can get to the URL and we can get to the demo server. So from there, the students try to act as an enrollment officer, and the member registration, every details that a certain patient, or let's say a person that is trying to do health insurance, needs to be filled by enrollment officer. And in Nepal, actually, the strategy vary by resources like house-to-house visits, registration ops, like you can see in the slide there. And the enrollment officer take the patient's data, the person's data, and then they form it and they fill the form in the openIMIS platform. You can see here, we provide students with the idea of how to add family, how to create a profile, how to put certain policies on a profile, then who the real contributors are and how the contributors really work. So that's how we show the students how a certain simulation can be done as an enrollment officer. So after that, on the incremental approach, there are many other tasks, like this one is a part of a practical task that they need to perform as a simulation. Then they need to create a certain openIMIS software, web software, and then they need to put it on the Linux server. Then after that, there is an FHIR standardization process where they will learn what really the FHIR APIs are. So this will also be assessed students will be given different assignments where they need to perform different roles, and they need to submit those assignments as well. So this is a certain screenshot of the task they need to perform. And we also give them hands-on simulation experience on how claims administrator work. Like you can see on the slide here, patients visit sales facility, they need to be verified. Then only they are allowed to take the services provided by the healthcare. So here, we provide them idea how a certain employee, let's say claim administrator, verifies the patient's data. So after the verification, what other tasks we need to perform to provide them with the services they are trying to have. So you can see here point of care registration addresses this by enrolling individuals at their first health facility visit. So patients are given their first health facility name on the paper they get. We all know that. So we explain this to students, how this thing really works and how the claim administrator really determine and validate that this person is genuine. So we give them all the ideas needed. We provide them with the idea to open which tab and where to validate. And after validation, how to give the services that user, and let's say the patient here, they uses. So we also tell them that because the demo server, let's say the local server that we are using in Kathmandu University, it has some random data inside it. We will clear it out in a few months. We will put some valid data inside it, but the services inside it are just random, and we try to give them idea that we can use the services accordingly, and in any authorized healthcare services, they can see the services like for general checkup, there will be services. For all the medicines that the patients will take, there will be a legitimate medicine name on the list that they search. So this is how we provide all the students the idea of how all these things work. And then we also give them idea of how review is done by the claim reviewer side. So you can see on the picture here, facility submits claim via openIMIS to payer institution. Reviewer checks claims and decides accept or reject, because this is a very vital validation that we need to do to check and validate the services, if it's legitimate or not, if it's payable or not, if it comes under the policy scheme or not. So the claim reviewer here does the job of reviewing all the claims, all the services that the patients have taken, and they review and they either accept it or reject it according to the policy they are in. So for this, there are also many different patterns we need to follow. So we also give the students the idea of how everything works. And this, you can see here, there is a certain feedback status here and review status here. So on the review status part, we can either accept it or reject the services taken from the patient, and the claim reviewer does their job of accepting or rejecting the services and the claims that has been utilized by the patient. So after this, we move on to lab-based practical sessions, but there's a certain assignment given to the student for the prior part as well. We give them assignments for data entry as well, where all of the students need to perform all these tasks. And it's easier in the server provided, because once we give the openIMIS applications the authentication of an admin, we can do all of these tasks at once. So after that approach, data entry approach, we go as an incremental way to the lab-based practical sessions, where the first thing is we provide them a case study of how openIMIS is being implemented in Nepal. Then we provide them the idea of openIMIS installation. So a big problem I faced in this certain experience, or let's say expertise I have with the students of health informatics background is most of all, let's say not all of all, but most of all are not from the technological background. So what we do is we provide the best idea of how APIs work. Actually, we need to explain them how really an HTTP protocol works. We start from there. We give them the basic informations, and there are videos that have that they can watch that have been created by us, Kathmandu University team, on the deployment part as well, and the basic and the minute details of how the deployment works are given to them. So any interested students from those, they can help us as well as help themselves as well to deploy openIMIS on the server. This is not mandatory for all the students because many are of different backgrounds, but we focus on the technical students, but we also give the non-technical students the idea of how everything works. So with my experience while teaching this, I have found that non-technical students are also quite intrigued with the thought of how everything works, and few of them have successfully deployed openIMIS uh, application on their Linux server. So we start from openIMIS installation. We go to the database configuration, server integration, system validation test, and then practical skill development. We provide them the hands-on lab develop deployment and ideas. All of these need to be provided to the students. So what we did was we could have used Docker as well for the implementation of openIMIS software in Linux server. But we try to give them all the minute detail ideas about how everything works, starting from what actually is HTTP server. Even though 70-80% of them already know, we try to give them the idea of how everything works and how a certain openIMIS software uh, can be deployed on a server, and how a server goes global, what actually SSL certificate is, and everything that comes in between, how all the DevOps idea. We try to provide the students with all these ideas. So I have some um, screenshots as well that will come soon after. This is our health informatics lab. It's on Block 9 on the School of Engineering, Kathmandu University. It's on Department of Computer Science and Engineering. This acts as an innovation of for advancing digital health in Nepal, because this lab is prominently for the specific ideas of all. You can see on the background there, DSIS2, openMRS, Fire, openIMIS, all the images are there, not just for decoration, but we do the tasks there. There are many individuals who are working on a certain specific domain only. DSIS2 only, there's some are working on openMRS only, there's some are doing their master's level projects, some are doing their PhD level project on different technologies. So the focus areas, we can see interoperability. The main idea here is to make the data interoperable. The FHIR API, even there are some students on Department of Computer Science and Engineering who were trying to do some health related softwares and apps, and I guided them to use FHIR API, and uh, told them that their database should look in a certain ways. The column names should be chosen wisely, because if you want to scale up this certain system or software, there is always a way if you use FHIR API. So our main idea here is to utilize this lab. We have very newest computers, very technically sound CPUs. So we engage in testing and implementing health data integration. And mainly we focus on Nepal's health reporting needs as well. And because openIMIS is also very widely popular, as well as it's the only health insurance scheme used and on a government scale. We tried utilizing it in our lab. Also, it's open source, and all the individuals working for openIMIS on in the Switzerland department and on the um, helping department, or let's say services, they are very supportive. I have never gone on an issue for more than 3 or 4 days. They have been very helpful for this. So utilizing openIMIS on our lab has been very successful till now. And quite here, the focus areas of our lab is mainly on interoperability, digital health training, research and development in health informatics, and radiology and medical image processing, because most of the students here are working on these data for their thesis as well as project. This is not about clinical radiology, but research-oriented radiology and image processing. So, moving on with this. So, our lab starts with a certain case study on the policy analysis of external sources, other health insurance softwares that globally people use, that globally government use, as well as compare it with openIMIS as well. And we gave them task as well. There is a certain research-oriented task. We give them the task of writing term papers or survey paper on health financing models. And then we go on to the openIMIS installation on Linux. So here we begin with the very simple basic things, as I told earlier. Then we install every needed technologies, the front end, back end, as well as database SQLs, let's say database components. All the modules are there in GitHub. We import it from there and we integrate it on our server. There are some screenshots. I'll provide it on the next slides. And then on the third lab on our incremental approach, we try to provide the students the idea of how FHIR really works and why the openIMIS database looks a certain way, why openMRS database looks a certain way, and how these things connect and how this is being utilized on a global scale. So on the lab activities, our Kathmandu University team has created a whole guideline on the different ideas we need to have, as well as all the certain pathways, all the installation techniques and all the related materials have been provided by us. And this document you can see on the left-hand side has been created by us. This has been around for 3 or more years. When I was reading on my master's level, when I was on my master's level in KU, I had that opportunity to create these guidelines, and we have updated these guidelines as well with time. So students receive both theoretical as well as practical instructions, and we provide them all the well-documented data to them. All the documentations are provided to them, so that they can learn all the ideas in the class, and they can also try utilizing those ideas when they um, get back to home or get back to their work. So all documents are created from scratch by the department with modules imported from GitHub repository profile. So by scratch, I don't mean to say that we have created everything because openIMIS Wikipedia page and GitHub page have been a very helpful for creation of all this. But I mean to say all the documents and the pattern and the one by one installation steps have been created by us for assisting students of all different diverse background from technical and non-technical field. So after the successful creation, they are able to create their own openIMIS um, um, deployment on the server. So we can see here there is a URL here where the openIMIS software is being run, and this way the students are able to run the openIMIS software as a whole, web software as a whole on the URL. So they integrate all the backend, front end, as well as database and all the necessary modules provided by openIMIS on GitHub. And we try to integrate all of those, and we teach the students how they really work. And after this, let's talk about some course impact on the students. The students from both IT and health backgrounds, we need to look at this subject very diversely because, as I told earlier, on the master's level, both health background students and IT, specifically IT background students, both can work together for taking participation in health informatics. And on the interview and selection of students, we try to enroll the students who have some experience on health related field, public health field, and we try to enroll the students from the IT background in such a way, as well as the same for health backgrounds with some ideas on how IT works. So they need to give the entrance exam at such and pass, and then we enroll them to the course. So the lab activity provides understanding of web server operations and all the module integration for running web applications. So if a certain individual or student tries to get into DevOps field, or let's say they are quite influenced, they are motivated by this server, working on server, they can do that. We provide them the idea of that as well. Also, people from health background, they will also gain certain ideas of how everything works, like how the web works, how web server works, how a certain web software uh, is can be used on a certain server, and how they can deploy a certain web system on a server. We try to give them the idea of as a whole of how web server operations are working in this world right now. So based on that, we also provide them how openIMIS works. We are creating employees from openIMIS as well, not of a standard mid-level or senior level students, but they can, if openIMIS tries to create vacancy for intern level, who has certain understanding of how thing really works, we provide the students the idea with this. So we are also trying to enable the local lab-based deployment of openIMIS, considering we also work on the SQL queries for creating localized data as well. Like I told earlier, on the services department, we try to provide on our local server, we try to provide the services that can be found in Nepal. We try to provide the geological locations that Nepal has. So we also try to train our students, if they are interested, to localize the databases accordingly. So it also exposes students to open source software. And as I told earlier, openIMIS developer team, they have been very kind to us. They have been very helpful to us. And maybe um, they are also a part of this whole openIMIS course on Kathmandu University, and they don't know that, because as a student, I learned so much from them. And I night and day, I used to work on this certain project, because I use this project as my own course project as well while I was studying in my master's. So And this is how everything evolved. So after this, uh, talking about assignments, practical simulation as openIMIS administrator. Um, every student is openIMIS administrator. And on the third point, you can see that hands-on experience with health insurance workflows. We provide them assignments with the practical exposure to different roles accordingly. So they need to write research paper for this subject as well as IMS 525 health financing, discussing on the openIMIS impact, let's say health financing, and how different countries are utilizing different um, health financing solutions as their software. And they will also gain the idea of interoperability issues. We will guide them into things like why uh, database looks the same in and what actually is interoperability. Like there was a question from my student, like they asked me that in openIMIS, they use table injury, TBL injury as a database table. And then other platforms, they saw in Fire API, they saw that the table name is patient. And I concluded that that was an older version. The new version is integrated with Fire API, and the issues that um, the certain database creation, or let's say data definition, creates if it's not created properly. So interoperability issues can also be there. They need to get the idea of all of this. So we try to provide them with the assignments accordingly. So our evaluation of individual students are based on the practicality, the practical simulation that they provide. Uh, we uh, we take a certain quiz and exam on the completion after the completion on the lecture part of this course. And the quiz and exams, it has different questions based on openIMIS architecture, fire standard, as well as in financing theory. So after that, research, they need to write a term or a survey paper for the health financing advancement and right now in the global scale. And then we grade them accordingly with the School of Engineering academic standards. So we expect the graduate to have a competency in the web server technology, where openIMIS has helped us because we are teaching health informatics, and we are using the openIMIS health financing system to help students know how the information technology actually works. So analytics and research, we provide them the different research-based assignments, such that it will have a very big impact on how things actually work globally right now. And talking about leadership qualities, we prepare graduate for their own career in IT sector, government NGOs, because they take certain information technology as well as health related terminologies, ideas, and uh, all the necessary details they need to be getting for their career ahead. So impact, we try our graduate to have an impact on the health financing and social protection locally in Nepal, because this openIMIS is being utilized in Nepal. So we can generate manpower here as well as in international context where they can be hired from openIMIS software developers by themselves as well. So this much for me for today. thank you very much for this presentation. Thank you very much, Ahin, for your time.
Thank you so much, Mr. Ashish and Mr. Professor Rabindra, for your excellent presentation. So we'd like to open the floor now for the question and answer. So to our dear participants, if you have any questions, feel free to unmute your mic or type them on the chat box. But before we start, just a quick note also that Professor Rabindra has another commitment for this round. So for any of your questions, Mr. Ashish will be able to answer them. Thank you.
Thank you, Professor Rabindra and Ashish. Like it was very helpful to have very practical explanation on the work that you do, and then I think it's a very helpful hands-on experience for the students that you train. And we are very happy to be associated with you both on work together on openIMIS. Just a couple
Thank you,
of
sir.
questions that I have. Um, it was mentioned previously by Rabindra ji that this is the third batch uh,
Yes.
of students of health informatics. Has anyone been like having got this hands-on experience in openIMIS? And has anyone like you are aware that from these three batches that they have got into health financing roles in the government or around, like, do you have any idea that these students have actually been placed because they get this exposure to openIMIS, and then Nepal is a big time implementer of openIMIS, is a nationwide implementation. So if the students can actually go back to take those roles after passing out of this health informatics course, that is a very good I would say that
Yes.
support to the country. Thank you.
Yeah, thank you very much for your question, sir. As of now, I don't think, according to my idea, there are any students that are who have already passed, have been working on openIMIS, but um, most of them are working on the public health sector on a good position on Dhulikhel Hospital and different hospitals. That Dhulikhel Hospital is one of the most prominent hospital in Nepal, which is very near according to proximity distance from Kathmandu University. I know most of them work there, but health, specifically on health financing, there is a certain gap. I don't think anyone's being able to do that, but sure, in the near future, I think some quite few of them were interested, but the vacancies were not there for this purpose.
Thank you. You also mentioned about their familiarization or training in terms of workflows. Is it something like a global workflow, or they also get an exposure to the workflows that are maybe customized or localized for the implementation in Nepal?
So thank you, sir, for your question. So our main idea was to provide them the idea and the idea of openIMIS and how everything works, and create a localized database for the implementation. So the main idea here is to create a localized database such that they feel very convenient while changing the data, while using the data manipulation languages for changing the data as well. So
Thank you. I do see a couple of questions already in the chat. Maybe Christine can read it out for you.
Yes, thank you, Sir Jai, Mr. Ashish. So we have a question from Dr. Chamika from Sri Lanka. So beyond curriculum integration, what specific mechanisms are in place to create a direct and sustainable pipeline from the academic program to the openIMIS implementation team and the broader digital health sector?
So we are still on the initializing phase for our department, and the resources are quite not that flexible for us right now. So, um, and we have meetings. We had just this meeting a few weeks ago about giving a proper global outreach of what is happening in Kathmandu University actually on the Department of Health Informatics. So I think in the near future we are going on that scale. So on the broader digital health sector, I think the next step that our department will take is to get recognized. So this is also a very good platform for that as well. Thank you, ma'am.
Thank you. We also have another question from Dr. Chamika regarding donor dependency. So it has been mentioned earlier. Dr. Chamika mentioned, as well as maybe a lack of supportive government policies. So which might lead to project termination when funding ends. And this might be common also for many countries in Asia nowadays. So his question is, what concrete steps are being taken or planned to transition the openIMIS deployment in Nepal, openIMIS deployment in Nepal from a donor-supported project to a self-sustaining government-owned and funded national asset? What long-term financial sustainability plan has been developed, and how is the project mitigating the risk of staff turnover and institutional knowledge loss? So I think this question, I think this should be answered also from the openIMIS, perhaps the coordination desk. So I'm just checking the participant list. I think we have some participants from Nepal and also from the coordination desk. So I don't want to put anyone on the spot, but if any of you can answer that question, because it might be of interest also to others. Thank you. We have a question from Dr. Chamika from Sri Lanka. What concrete steps are being taken to transition the openIMIS deployment in Nepal from to a self-sustaining government-owned and funded national asset? Over.
Yeah, okay. Allow me to clarify that point on Sunil now that he is on spot. That was actually a reaction to the previous question from Jai, where he was asking about like the professional options of or professional effect for participants in the trainings. So I didn't have a good example on someone who has gone through that training and got a good job afterwards, but I had that example from Sunil, who is like already an active member and doing his thesis on openIMIS now, and of course we expect him to like become a very successful professional to get his yeah, I don't know, to have to support his life with that kind of work. But that already leads to the second question, because what I'm seeing here, and I'm exchanging hearts with like some people in the chat already, like on a bilateral basis, because what I'm seeing is something that I really like. I mean, like the curriculum looks very nice, very structured, and the things they are addressing are on many different levels, like looking at the political level of policy formulation, looking at the practical levels of installing stuff, and creating an understanding of how the importance of interoperability and all those things. I think from getting to the practical situation in Nepal, from how I'm seeing it from far only, I have to admit I'm not in the project, but from the things that they are doing, I think Nepal is on a very good route of getting independent on this. Of course, there's always funding needed. I mean, there's always funding lacking for everything, but if I look at sustainability coming from the coordination desk of openIMIS in headquarter, if I look at sustainability, I'm always having this picture in my mind where, like, because of some global catastrophe or some political thing that we are seeing in other countries these days, if because of some disruption like that, our funds get cut from one day to the other and we are not able to work anymore, then I'm always trying to imagine, what remains. And of course, there's the code. There, our website will go down, but all the experts that we have been training, all the people who have been contributing to openIMIS in the last decade, basically, they will remain. And the training that you guys are doing in Kathmandu, and the practical implementations that you have in the Social Security Fund and in the Health Insurance Board, I think you're really on the way of creating a strong workforce that is able to carry on, even if like GIZ would shut down next week because of some stupid problems, and we at the coordination desk level would no longer be able to support it. So I'm always trying, like I'm seeing that in Cameroon as well. I'm seeing that in the Gambia and like countries where local entrepreneurs have picked up the work. That of course you have the capacity in the country, and that's I think the only way of creating sustainability. You know, it's of course the organization, they have to take care of IT costs for servers and stuff like that, but having the brains in the country to really manage the system, I think that's the main pillar for sustainability. And if I imagine the people I have seen so far from Nepal, who are working on this, if I imagine them just being independent, working on the systems themselves, I'd have full confidence in them. It's the code is there, they can have it, and they can use it, they can fork it, they can do whatever, and they have the capacity to do it. So I'm very optimistic about this. Sorry, I'm getting very emotional about these things because it really, it's the fruits of more than 10 years of work that we have invested in, and it really looks nice.
Thank you for sharing that
That
thought.
was very wonderful. Thank you very much.
Thank you, Uwe, Mr.
I know we are
Ashish.
over time. I just wanted to add one line to what Uwe said. I think openIMIS has really created this community in Nepal. Like for example, Sunil here, who is in the call, and then this community can not only actually support the ecosystem within the country, but they can also support openIMIS deployments or any customizations in the region. I think that's very important. And then, like for example, this particular training which you are giving a very hands-on experience, I think that also helps that. So I just wanted to make that comment, and then I think it's a very positive future if you could actually broaden this opportunity of being able to export this this ability that you have in the country to even other countries which are implementing or customizing openIMIS. Like we had this in one of the countries that we were involved in support through TinkerTech. So I think it is possible in other countries and other opportunities also. Thank you.
Thank you, Sir Jai. So before we end, just wanted to acknowledge also some messages on the chat box. So we have a message from Mr. Sanjaya. So the use case of BAMI integration with openIMIS back in 2019 is being used for the global use case for ecosystem and community. And we also have some technical clarifications from Patrick, and also invitations to if we have any students here on the call, if you want to contribute to the community, so please feel free to reach out. I think we have good parting messages shared already by Uwe and Sergei, our executive director. And of course, a huge thanks to Mr. Ashish and his team for this very comprehensive sharing and presentation. Before we finally end, we'd like to invite everyone to open their cameras for a quick group photo. Thank you, everyone.